Keep boredom at bay with reliably fast Wi-Fi throughout your home. From Cox Panoramic Wi-Fi. With the bars you need from bedroom to basement, there's no room for boredom. Click to learn more. Speeds vary and are not guaranteed. Restrictions apply.
There's only one place to find the most recognized brand in carpet, Stainmaster, and that's at Lowe's. Right now, get free basic installation with the purchase of Stainmaster carpet and pad, $4.99 or more. Lowe's, home to any budget, home to any possibility. Install available in-store only. Requires non-refundable site assessment fee. Fee is credited to final project price if bought through Lowe's. More charges may apply. Not available in all areas. See Lowe's.com for details, exclusions, and licensure. Valid 2/19 through 4/13. U.S. only.
Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Millicent Rovello, and I am here today with my amazing and ageless co-host, Dr. Jay Calvert. How are you?
I am ageless. I am not aging. That's the way that I see it.
That's the way I see it. That's how it should be. I mean, we are plastic surgeons.
That's
Why
right.
should we age?
Aging is optional.
I agree.
So
I opt out.
Yeah, and that's what we're going to talk about today is age as it relates to plastic surgery.
As it relates to plastic surgery. And so specifically, what are the medical risks associated with having plastic surgery as one gets older? And then also, what are the challenges that we as the plastic surgeons face in creating aesthetically pleasing looks for the older patient?
Yeah, I mean, and age really is sort of optional. I mean, a 50-year-old today, voila, is very different than the 50-year-old that I saw as a 10-year-old kid.
Absolutely.
They're really different.
Totally different. That whole thing like, oh, you're over the hill when you're 40. Like, I'm sorry, no, that's not a thing anymore. Can we move past that? And that whole, little silly saying age is just a number. Well, it kind of is just a number, especially if you have been doing a good job of taking care of yourself over the years. And certainly I have patients that are in their 50s that are in amazing shape. They're running, they're triathletes, they swim, they've been taking good care of themselves. And for them, age really is just a number. And then I can have some patients that are 35, 40, diabetic, overweight, smokers. And for them, they might as well be 60. So in that regard, yes, age could be just a number, but really it comes down to how healthy an individual you are. And this is in regards to how well you will tolerate general anesthesia and surgery.
For sure. And it also relates to the response of the body, the organism, the human that is being surgerized, that is being operated upon. Because operating on a 17-year-old nose is very different than operating on a 50-year-old nose.
Right. The tissues have changed over time.
Very much so.
Very much so. So let's just do sort of a basic medical thing about surgery in general. We kind of touched on this when we did our obesity and plastic surgery talk, but there are some medical concerns that arise as a patient gets older. We all know that with increasing age comes increased risks of heart attack, stroke, vascular problems, hypertension, all things that could have potentially worse outcomes with general anesthesia. And for that reason, I have sort of a pretty, standard protocol of what I do. Anyone over 40, 45 gets an EKG. Everybody gets a medical clearance. We all get labs. And I sort of put it back on their primary care or their cardiologist to tell me that this patient is medically optimized or is at a low risk or moderate risk for the surgery that they're going to have. And once I sort of get that A-OK from their primary doctors, then I'm comfortable proceeding with surgery. That being said, there is no guarantees. There is always risks the older you get with some of these systemic complications, but thankfully they are very, very rare, at least with the kind of surgeries that we do.
Well, and on the patients that we operate on, I mean, you have to remember the anesthesia classes of, the outpatient setting. We are not taking ASA, anesthesia risk categories 3 and 4. We're doing the 1s and the 2s, which means that they are essentially low risk for general anesthesia.
Low risk for anesthesia, although I will say I probably do the 3s in my hospital setting.